Hello, my name is Dr. Arun Lakhanpal, and today, very briefly, I'm going to talk about diabetes, and hopefully this will answer some of your questions. We as Indians are particularly prone to diabetes, perhaps due to a combination of genetic factors, our body composition with excess fat and our abdominal girth, as well as our carbohydrate-rich diet. Diabetes is basically an impairment of metabolism of glucose, which is the way our body handles or metabolizes glucose. It is basically of two types: type 1 diabetes, where there is a deficiency of insulin, which our body naturally produces, and type 2 diabetes, which is due to resistance to insulin, perhaps due to excess body fat. In this case, the body normally produces insulin, and perhaps its insulin production is actually increased, but the tissues are less responsive to insulin. It's very important to recognize the symptoms and to control diabetes, because this is a systemic illness and can affect almost all organs of our body. It can lead to atherosclerosis, which can lead to strokes, heart attacks, limb amputation due to gangrene at an early age. It can affect the nerves, giving neuropathy, can lead to kidney failure, heart failure, heart attacks, and increase your chances of getting infections if your blood sugars are not under control. Thankfully, there are wide varieties of treatments available, but the cornerstone remains diet and exercise. If you have a family history of diabetes, that is, if your parents had diabetes, your chances of developing it are increased. Diabetes can present itself during pregnancy, which is gestational diabetes, and in most cases this will settle after delivery, but it may persist in a fairly significant number of cases. There are other rare conditions such as cystic fibrosis or pancreatic failure due to chronic pancreatitis from alcohol or infection, where patients develop type 1 diabetes. All such categories should be vigilant about the development of the disease. Number one in its treatment is diet. So you have to cut down on carbohydrates and starches, which means you have to cut out the potatoes, the biscuits, even the salty ones, rusks, white rice, etc. You need to stop adding sugar to your teas and coffees. You have to reduce the diet at every meal time, although the total calorie intake should not come down, which means rather than having 3 major meals, breakfast, lunch and dinner, you need to spread it over 6 meals, that is 3 major meals, where you reduce the amount of food that you consume and take snacks in between, such as an apple at 11 or few nuts with a bland tea or coffee at 4 or 5 o'clock, or a glass of unflavored milk later on. You must realize that there is a lot more that you can have in your diet. You can have pulses, you can have vegetables. If you take non-vegetarian food, eggs, milk is fine. You have to avoid red meats, but grilled chicken, fish is fine. You can have pears and apples, and you can have dry fruits, but you must avoid high calorie, high glucose content fruits and nuts, such as raisins or dates or grapes, mangoes, bananas etc. Best would be to have a diet chart which is tailor-made for you by a dietitian. Then comes exercise. This is not only important to burn the extra glucose, but also to reduce extra fat, which will reduce your insulin resistance, and you may need to take less medication and your blood sugar control will improve. Also, the exercise is important to maintain your muscle mass, which tends to go down if you have diabetes, and will also improve your cardiovascular fitness, making you less likely to have diseases such as stroke and heart problems, which have an increased chance of happening if you have diabetes. Apart from that, you have to drink in moderation, and the best policy is to try and not smoke. Third comes the part about medications. Yes, most people would need to take some kind of a medication or the other, although some people with milder form of the disease can control their blood sugars by dieting and exercise alone. But once you have been started on treatment, which could be insulin or tablets, then it is very likely that you will have to stay on them for life. I see many patients who try various alternative therapies to try and come off the medications, but this is rarely, if at all, successful. I would suggest strictly monitoring your blood sugars and keeping in touch with your doctor if you are trying these alternative medications. I personally would recommend against those. The side effects of these medications that had a bit of effect on the heart have now been gradually phased out, and now the newer tablets are extremely safe. The best medication for treating diabetes remains insulin, and we are moving away from a time when you have to inject yourself multiple times, and we have preparations that are given just twice a day, and we are now moving on to pumps that mimic the natural secretion of insulin. It is extremely important to regularly follow up with your doctor, even if your blood sugar is under control, and this would be to monitor the effects of diabetes on the circulation, on your heart, especially the kidneys and the eyes, the retina. I hope this presentation has answered most of your questions, but do keep in touch with your doctor.